Lee Sittig, and I am a staff member at the Iowa Cancer Consortium. This webinar is being brought to you today by our partners at Gilda's Club of the Quad Cities. I know many of you are very familiar with the wonderful services that they provide. If you're not familiar with Gilda's Club or the Iowa Cancer Consortium, if you look down at the right-hand window of your webinar window, there's a box that says Web Links, and the first two links say Iowa Cancer Consortium and Gilda's Club of the Quad Cities. You can highlight those and click the Browse To button if you'd like to open a browser to the two websites for the organizations and learn a little bit more about either one of them. Before we get started, I'm going to walk you through a few more webinar features so that we can get the most out of our webinar here today. On the upper right-hand side of your screen, you will see a chat box where you're all invited to interact with others on the call and ask questions to the presenters. You'll see right there, it already says, welcome to Frankly Speaking About Cancer, Treatments and Side Effects. Has some more information. You can add to that discussion. If you're feeling up to it, we can practice using that chat toolbox quickly. If you would all enter one thing you're hoping to learn about tonight, we can get that discussion started and practice using that nice chat tool. If you're listening over the phone, I'm going to say one more thing about the chat box. If you have questions during the presentation, please feel free to type them there at any time, and we'll make sure that they get answered after the main presentation. So we probably won't stop the presentation to answer questions, but please type them at any time. We will collect them and make sure that they get answered for you tonight. If you're listening over the phone, you will also have the option to ask questions using your phone line after the presentation. But until that time, if you would please mute your phone line by pressing *# or using your phone's mute and unmute feature, that would be wonderful. You can also unmute your phone if you've used the *# by pressing that again. So please mute your lines using *#, and when you're ready, unmute using play. If you're having any sort of technical difficulties at any time during the webinar, please tell us in the chat tool. We will keep a good eye on that for questions and, again, any technical difficulties you might be having, and we'll definitely work with you to resolve the issue. Today's webinar is being recorded and will be posted online. If you look again at that web links box, there is one that says today's webinar recording will be posted here. So you can click on there and then click Browse To, bookmark that page on your browser, and you'll be able to come back to that and see the webinar recording if you would like. It will also be available, so you can also get a recording by contacting Gilda's Club at 563-326-7504. I'll make sure to put that in the chat box so that you all have that. We'll do that towards the end of the session. You can also email Kelly, K-E-L-L-Y, at gildasclubqc.org for information about the recording. So I see you all entering lots of things that you're hoping to hear about tonight. Again, please feel free to type your questions or comments anywhere at any time in that chat box. We'll collect those. But with our housekeeping out of the way, I'd like to introduce Kelly Hendershot, who is Program Manager at Gilda's Club of the Quad Cities. Kelly?
Hi, everyone. Thanks for joining us tonight. This is kind of new to us, too, not being able to see faces in front of us, but we're hoping that this sort of technology will allow more people to attend webinars in the future, and it's something we hope works well tonight, and we'll be able to try again. For people who are new to Gilda's Club, we do encourage you to come in if you've never been here before, just to check out the location. We provide free services to all members, whether it be the person with cancer, family members, children. We cover a wide range here. So we are fortunate to have many area partners who join us for webinars and presentations like this, such as Katie Brown, our speaker tonight with Iowa Cancer Specialist. I'll let Katie share a little bit more info about herself before we go ahead and get started. Katie?
Well, thank you for having me. My name is Katie Brown. I'm a nurse practitioner with Iowa Cancer Specialist in Davenport. We have 3 physicians, myself there, and I've been a nurse practitioner just a couple of years now, and I was an oncology nurse for 12 years prior to that. So I'm excited to do this, and I hope that I'm able to help answer any questions you might have. So I think without further ado, we can get started. Workshop overview. Myself, and then we have Melissa Wright and Kelly Hendershot, who will be covering some more topics later in the presentation. We're going to discuss partnering with your healthcare team, common side effects, living with cancer, and then taking care of questions and answers at the end. All of these slides were medically reviewed and updated by these 2 advanced practice nurses. Just January. Start with tips for living in this strange new land. As you can see there, you or your loved may have gotten a cancer diagnosis, but that doesn't mean that the cancer has you. So we're here to help you educate yourself, get support, and also to help you find your hope and courage. There are many support and resources available to help you. There's a cancer support helpline, cancer experience registry, which is people that have themselves been touched by cancer. Frankly speaking about cancer, and open to options. And also you'll be able to find more information at the web links on the side in the lower right-hand corner from the Iowa Cancer Consortium, Gilda's Club. I had put in another one that I think is really great down at the bottom, nccn.org. We use those guidelines a lot as healthcare providers, but there's an excellent patient section too. Ways tonight are to be knowledgeable about your treatment, learn how to prevent, recognize, and manage side effects with medicine, mind, and body, track information about appointments, treatments, and side effects in a planner, create a strong support system, ask questions, and advocate for what you need, and make choices that are right for you. So understanding your treatments and side effects, it's important to realize that cancer treatment is unique for every individual. So if two people have the same type of cancer, it doesn't automatically mean their treatments will be the same. They could be very different depending on the staging of the cancer and any other health issues a person might have. Different treatments and different drugs cause different side effects. So not everyone will experience nausea or vomiting, and not everyone's going to lose their hair. And it's important for you to know your own individual treatment plan and understand how to take control of your side effects. When you're first starting out treatment, you should receive chemo teaching before starting any new medications. And this usually covers whatever drugs most common there. But of course, questions do come up along the way, so never hesitate to talk to your healthcare provider about any concerns that you have. Your healthcare Communicating. It's always a good idea to write questions down before you go to the doctor and bring them to your appointment and use them to talk to your health care. It's a great strategy to help keep your thoughts organized. Chemo days are always busy ones, and it's easy to forget what our questions are without having a list. Bring in your planner with information about fatigue, pain, and any side effects you experienced since your last clinic visit. So while your healthcare provider may ask you about all these symptoms, it's good to keep the log of any problems you've had and what you've experienced, because it could change the dose of the chemo you receive. Bringing a friend or family member with you to take notes. Well, this is helpful. Not only will you be free to listen to and interact with your healthcare provider while your family or friends are taking notes, but you'll also have your support system there with you. And then tell your doctor or nurse about all medications you're using, including over-the-counter medications, vitamins, or supplements. And this is so important because over-the-counter medications, vitamins, supplements, they all have side effects of their own, and there may be interactions between them and the chemotherapy, which may make the chemo work differently than it's intended to. More communication, asking your healthcare team what side effects to anticipate in the upcoming weeks and in the future. Like I said, the side effects should be reviewed before even starting the treatment, but never hesitate to ask questions as they come up along the way. Ask your healthcare team about issues related to intimacy with your partner or other emotional concerns. So we aren't just here to solely focus on physical issues. We are here to try to help with any concern that affects you during this time, even if it's just, helping point you in the right direction. And ask about other resources available to you: nutritionist, social worker, art or music therapist, pastoral care, psychologist, psychiatrist, fertility specialist, case manager. There's so many resources and different providers out there to help you through this journey, and we can help you get in touch with them. And also ask your health how you can work together as a team. Side effects and symptom management. Many cancer treatment centers combine standard therapy with complementary and alternative medicine, or you may have heard it called CAM. The most common CAM and integrative medicine techniques are nutrition, exercise, relaxation, acupuncture, chiropractic techniques, healing touch, guided imagery, meditation, massage therapy, and herbal medicine. And talk with your doctor and nurse to learn more about these services. And there's also a link in the lower right hand, the web links to the National Institutes of Health. They have some information about complementary and alternative medicine that is good and evidence-based. Palliative care. This focuses on providing patients with relief from symptoms, pain, and stress of a cancer diagnosis. It can start when any treatment begins. And the goal is to improve quality of life for the patient and also attends to the needs of family caregivers. It is provided by a team of healthcare professionals. They work together with the patient's other doctors to provide an extra layer of support. And it is not the same as hospice care because this is for people that are currently going through treatment. It kind of helps to clarify goals at the start and, you know, what you do or don't want to happen throughout your treatment. Now we will get right into common side effects. These include anemia, which is low blood counts, bleeding, constipation and diarrhea, emotional distress, which can include depression, anxiety, fatigue, hair loss, infection, mouth and throat changes, nausea and vomiting, nervous system changes, neuropathy is one of those, pain, sexuality and fertility changes, and skin and nail changes. And we'll start right out with fatigue. It's the most common complaint of cancer patients. It's described as feeling tired, exhausted, or worn out, and it's often more intense than ever has been experienced before. A lot of times it is kind of cumulative. As you go through treatment, you may notice that you're feeling more fatigued. So tips to conserve energy: always ask others to help you. They want to help you. A lot of times they just don't know what the best way, what the best way to help you would be. So let them know if there's something they can do for you. Make sure you... Okay, so back to pain. For managing pain, we should be asking specific questions, and if we don't, make sure that you're cluing us into this. So we need to know where exactly is the pain, be able to point to it. How would you best describe it? Is it sharp, stabbing, aching, dull, burning, throbbing? Does it come away or does it go away, or is it there all the time? Do you wake up with it? Are you able to sleep? Is anything to make it better? Pain, any heat, or ice? Does anything make it worse? What medications have you tried? And then, we always like to use scales. So 0, if 0 is no pain and 10 is the worst, how would you describe it? What number is it? What number is it after you take something for pain? And of course, if you are prescribed medication for your pain, take it as it is prescribed and don't skip doses. Sometimes we give long-acting medication, which is supposed to be taken either every 24 hours or every 12 hours, and that's to help keep your pain at a more manageable level. You may still need doses of extra medication in between, but if you skip those long-acting doses, you're going to be a lot more uncomfortable. It's going to be harder to get the pain under control. And you want to not wait until the pain is so horrible to try to take the medication, because then it, like I said, once it's out of control, it's much harder to get back into a comfortable state. Don't increase or decrease your pain medicine on your own, because pain medicine does have a lot of side effects. And of course, you want to talk to your doctor, your provider. All of the opioids, so all of the narcotic pain medicines, have that dreaded side effect of constipation. So that's something you want to plan for and discuss ahead of time and try to prevent. And just a side note, with those long-acting medications, it's important that, if you're having trouble swallowing, you cannot crush or chew or cut those tablets in half, because it will, it could be very dangerous. It releases all the medicine right at once instead of over a controlled period. So always take them as directed. More on managing pain, you want to talk to your doctor before starting or taking any new medicines, prescribed or over the counter. And that's just important because medications interact with each other. And certain medications can, if there is an interaction and we're not aware of it, you may not be getting the results that we would want you to have from another one of your medications. You can consider yoga, deep breathing, or muscle relaxation to help manage pain. And it's important to remember that you have the right to have your pain controlled. We do have so many different things that we're able to try that we don't want you to suffer. It is truly important to keep your doctors up to date on how you're feeling through your cancer experience, so you can get the help you need. Okay, moving on to nausea, vomiting. Like I said earlier, not all treatments cause nausea and vomiting. I'm going to talk to your doctor before the treatment begins about medications to prevent or control nausea. A lot of times we automatically will give you a medicine before we give the chemo, an anti-nausea medicine. A lot of times we give a steroid too, and those both help to prevent it. But we still send people home with a prescription for something to take if they experience nausea and vomiting at home afterwards. So make sure you fill the prescriptions, even if you haven't, fill them before you need them. That way you don't have a rush to go to the pharmacy and you're feeling horrible. And eat a light meal or snack a few hours before treatment so you have something in your stomach. If you do notice that nausea and vomiting is a problem, don't eat big meals. Eat 5 or 6 small meals throughout the day. You want to avoid foods that are spicy, really heavy foods, greasy foods, foods with strong odors. So choose foods that are cool or warm, not too hot or cold. And if you find that you're having lots of nausea and vomiting at home after your treatment, and the medication that you were given is not working, make sure that you contact the office, because there are several different medications that we are able to try. And there's also acupuncture or acupressure. So that's a complementary and alternative medication or medicine for you. For constipation, some cancer treatments cause constipation. Pain medicine also causes constipation. The best way to avoid it is drinking lots of fluids and to stay active. So trying to get a moderate amount of exercise every day. It's hard to do when you're feeling fatigued, but when you're not moving around very much, that can complicate constipation also. You want to check with your doctor about adding fiber to your diet. So whole grain breads and cereals, beans, raw vegetables, fresh fruits, water, water, water. And if you haven't had a bowel movement in 2 days or have abdominal pain, talk to your doctor or nurse. Diarrhea. Some chemotherapies can cause diarrhea, and infections can also cause diarrhea. If you are experiencing more than 3 loose stools in a day, you would want to call your doctor. And before you take any of the over-the-counter anti-diarrhea medicines, you want to discuss this with your doctor also, because there are some infections, if you've recently taken antibiotics, that you may be more prone to. So sometimes we need to do testing on the stools to make sure that that's not a thing that you're experiencing. Make sure that you're staying hydrated, plenty of fluids like water, sports drinks. And then, of course, you want to take care of your skin and wipe gently after each bowel movement. If you're feeling really poorly and having lots of loose stools, make sure that you call. Sometimes we have to bring our patients in to get extra lab testing and give them some IV fluids in the office, and we can really make them feel better than how they were feeling before they came in. It is important that you still try to eat something while you have diarrhea. So they call it the BRAT diet: bananas, rice, apples, or applesauce, and then toast. And you want to avoid really hot or cold drinks, caffeinated products, alcohol, spicy, greasy, fried foods, milk products, or any gassy foods like cabbage and broccoli. Really anything that, if you know that something bothers your stomach, then avoid it. And so if you do develop mouth sores, talk to your doctor or nurse. Eating softer foods that are easy to swallow at cooler room temperature will cause less discomfort, and you don't want to have hard, crunchy foods because those can really scratch a lot going down. You can use ice chips or popsicles. And also, we sometimes prescribe medicated mouthwashes that have a numbing agent in them that would help with pain with swallowing. And then tips for dry mouth: just sipping water throughout the day, sugar-free candy, sugar-free gum. There are saliva substitutes that you could spray into your mouth. And then using sauces or gravies will help to make foods easier to swallow. And then changes in taste and smell can affect what and how much you eat. They are often temporary. So if you find that you're not eating because nothing tastes good, nothing smells good, talk to the doctor. We can get you a referral to a dietitian or nutritionist who has a lot of tips on how to make things more palatable, and specific points like I had said, if you have a metallic taste in your mouth, sometimes using plastic silverware can help more than, the metal ones. For hair loss, not all treatments cause hair loss. A lot of times they'll talk to you ahead of time if you are going to, if you have a treatment that everybody loses their hair, they'll let you know. They don't want that to come as a surprise. It's often temporary. So once you're all done with your treatments, it does start to grow back in weeks to months, a lot of times different texture than it was before. So that's always exciting to see how it comes back. If you plan to purchase a wig, try to make your selection before you lose your hair. And your cancer center may have a wig bank. You can talk to your doctor about a prescription for a wig because certain insurance companies supplement or cover the cost. You can also use hats, scarves, or turbans. You want to protect your scalp from exposure to the sun. so by wearing a hat or definitely sunscreen. Keep your head warm. And sometimes people say that the wigs bother their, are kind of sore or uncomfortable to wear. So, softer fabric things may make you more comfortable, or sleeping on a satin pillowcase. Hair loss can make both men and women feel depressed, embarrassed, self-conscious. So talking about these feelings can help. And it can help to contact your social worker or discuss these feelings in a support group, because you are definitely not alone in experiencing them. Nervous system changes. Ask if your treatment can cause damage to your nervous system. So people can develop neuropathy, which is burning, numbness, tingling. A lot of times they'll get it in their fingers and toes. You can also have some muscle weakness, loss of balance, hearing loss, or even confusion. You want to, if you notice that this is being a problem, a lot of times people don't think it's anything that is important enough to speak up about, but actually if it's, making it so you can't button your shirt, then we would, reduce the amount of chemo that you'd be getting, the next treatment, because that can continue to worsen and it can become painful. So never hesitate to talk about these types of things. You want to avoid injuries by being cautious when you're cooking or using sharp objects. You want to wear gloves in the garden and when washing dishes, because you don't want to cut yourself and not even realize it. Avoiding falls, so wear sturdy shoes. Use the handrail on the stairs. You want non-slip mats. You don't want cords across the floor, because falls can be very they can have terrible consequences, so always best to avoid them. Cognitive changes. Chemo brain, they call it. So changes in memory and thinking ability, or difficulty learning new things, kind of feeling like you're in a fog, referred to as chemo brain. So some tips for that: keeping lists. So if you already have a planner or a dedicated notebook that you take with you to treatments and everything, you keep your list of questions, but other things that you need to do too. Make lists for those, cross off your completed items. Using planners, or you can set alarms on your phone, use an appointment calendar, organize your surroundings, keep things that are important or that you use all the time, like your keys or glasses, have a designated spot for them. And try to eliminate distractions whenever you have a task to accomplish. So if you have to get something done, try to make sure that you've got the TV off and you're not being overstimulated by a million different things. Try not to multitask. Just do one thing at a time, and try to keep track of when you notice that you are having chemo brain. Sexuality and fertility. Many types of cancer and their treatments can cause sexual issues, and some of these include loss of sexual desire, erectile dysfunction, loss of fertility, pain associated with intercourse for women, vaginal dryness, and early menopause. And these are all very valid issues that are important to talk about, and there are things that can be done about them, so it's important to bring them up. Communication is key. Make sure that you're talking with both your partner and the healthcare team. And you want to discuss the use of birth control with your doctor, as some of the chemotherapy treatments, it would not be the best situation to have a pregnancy while if the woman or the man, if either one of them are receiving chemotherapy. Discuss use of contraceptives or birth control during active treatment. Sexual health and fertility specialists are found within hospitals. So there are, in the bigger hospitals, there are places we can refer to. And be open to discovering new ways for you and your partner to connect and feel intimate with each other. You want to talk to your doctor as early as possible if you would like to explore having children after a cancer diagnosis, because we can do sperm and egg banking or tissue freezing, but the best time to do this is prior to the start of any treatment. And of course, you would need to check with the insurance company about what is covered before starting these procedures. And if banking or freezing is not an option for you, you may want to discuss alternatives such as surrogacy, adoption, or using a donor. Your skin and nail changes. If you experience severe redness or blistering of your skin, especially hands or feet, or any other skin changes, call your doctor immediately. Some of the chemo drugs have what's called a hand-foot syndrome, and it can cause this, swelling, redness, pain, burning, and peeling of the skin, and it's usually on the palms of the hands and the soles of the feet. And we usually hold off on the medication while that resolves so you don't develop more pain and infection. You want to be gentle with your skin. Moisturizing is recommended. If you're undergoing radiation, you want to check with the radiation doctor and nurse because they have special lotions that they may want you to use. And I always say if you're having if you have dry skin, the best type of lotions to use, if it says cream instead of lotion, and you want to avoid things that have colors and fragrances because those often have alcohol in them, which can actually be more drying. It's good to wear soft clothes and use soft sheets made of fabrics like cotton. And you don't want to put anything hot, like a heating pad or an ice pack, on whatever area is being treated. If your nails are cracking, splitting, or lifting, let your doctor know. For itching, you don't want to be soaking in hot tubs or jacuzzis. So try lukewarm showers rather than very hot showers. You can use oatmeal bath for itching, and a moisturizing soap. Pat dry, don't rub too vigorously, and then apply the unscented cream or lotion while your skin is still damp. Like I said, avoid fragrances and avoid the colored lotions too. And if it says cream, then it's going to be more hydrating. For sun sensitivity, you always want to use sunscreen, including lip balm with sun protection, hats, other sun protective clothing, even in the winter months. Avoiding prolonged sun exposure and never using a tanning bed. Sometimes if you've had radiation to a certain area, or even certain chemotherapies will have like a radiation recall type reaction where you can develop a rash very easily after exposure to sun. And you don't have to be actively getting treatment. It can happen after the fact. So it's always good to use sunscreen and avoid direct sunlight. You don't want to bite your nails or wear fake nails. Fake nails could harbor bacteria underneath them. And your regular nails can have bacteria too, so you don't want to be biting them and getting the bacteria into your mouth. And you also don't want to, get cuts on your fingers, which would then be areas that could get infected. You want to talk to your doctor before having a manicure pedicure due to infection risk. And if you notice that your skin is very dry, you can wear gloves while washing the dishes to avoid excess dryness. Moisturize hands and feet frequently. If you are on one of those medications where we ask you if you're having redness and peeling in your hands and feet, a lot of times we recommend a vitamin E hand lotion to put on your hands and feet at least 3 times a day. And now I'm going to turn it over to Kelly to talk more about living with cancer, I believe.
All right, thank you, Katie. So living with cancer is something that we talk to people quite a bit here at Gilda's. Again, if you're not familiar with us. Some of the main feelings that people have when they're faced with cancer are loss of hope, loss of control, especially since your day is pretty much regimented by when your treatment is, what kind of drugs you're having to take. There's a lot of loss of independence. A lot of uncertainty goes on. And that's why we feel that it's important to talk about those things, especially when you're in a group setting. There's other members that can help you work through that uncertainty. And there's definitely a sense of unwanted aloneness. Even if you are married to the best spouse in the world, you do still feel alone because they're not going through what you're going through. So these are all important issues to be talking about and being vocal about. Emotional distress, first of all, is something that should not be ignored. I know a lot of times I hear it in my groups. I facilitate the family group here. People will say that they're being weak if they cry, if they spend too much time venting about something. And, you know, with everything you're going through, it's sure not a sign of weakness, and it's definitely nothing to be ignored. If you do ignore it, it kind of helps increase the amount of anxiety you might feel. People are more prone to stress, depression, mood swings when they're feeling emotional distress. A few other things that you might notice are irritability, insomnia, fear, isolation, denial, and again, that loss of hope. These are all normal things, but just because they're normal doesn't mean that they should be ignored. And you might notice day to day or even throughout the day that the amount of distress that you're under can change and fluctuate. If you feel that you're spending more time than less time throughout the day feeling distressed or just feeling like you have this huge sense of loss of control, then we do suggest that you seek some professional help, whether it's talking in a support group or doing one-on-one counseling. I recognize a lot of the numbers and names that are on these attendee lists, and a lot of you are our members, so that is great. We love seeing you here. We'll see most of you here tomorrow night, I think. But if you're not one of those people who are in a group, make sure that you are talking to somebody about these issues, and we can help you, put you in touch with different resources too, depending on what you're feeling. With all this whirlwind of activity going on, it's important to make sure that you kind of take a break and reassess how you're feeling each day. That is important in not only keeping a positive attitude, but it's really kind of a survival and coping mechanism. Some different ways that people do this are journaling. Writing down your thoughts is a great thing. I know a lot of people who will keep a notepad by their bed because they have trouble sleeping at night, and it's just a good time to get the thoughts down. Spending time with friends and family. I know that Katie talks a lot about fatigue, but that is something that can help cope with the stress of the situation, spending time with other people. Certainly explain to them that you're tired because of the treatments that you're receiving, and I'm sure that they'd be understanding if you need to cut visits short. But it is really important to take care of you. Some people find that they need to reconnect or connect more with their spirituality, whether that's going to church, taking a hike out in nature. It can mean different things for different people. For some people, exercise is what's helpful. If you are going through treatment, we definitely don't suggest that you start a new form of exercise without talking to your doctor. But if you're already someone who likes to bike or to swim, by all means keep doing those things. You just might have to slow down a little bit depending on where you are in your treatment cycle. And as Katie talked about earlier about watching for cuts and things like that, biking, some of the more endurance and high-risk activities like that where you could have a fall, just be careful with those. But definitely make sure that you're planning time in your day to enjoy things, reading, music, movies. I know a lot of folks in my group are Netflix bingers, so make sure that you're still doing stuff that makes you feel good about yourself. So again, just to come back on that feeling of loss of control, to help empower yourself, here are just some different things you can do. Set goals for yourself. If you are someone who does like to go walking, but you know that your treatment slows you down, set a goal of X number of days a week I'm going to walk, where in the past you might have been out walking 7 days a week. Maybe make your goal 2 or 3 times a week just to kind of get back in that habit, but you still have that sense of achievement just from reaching that goal. Find different resources on what can help you. Talk to your friends, talk to other people going through treatment. All great ways to get suggestions on how to kind of feel more under control of the situation and how to kind of get your life back. Don't be afraid to ask for help, whether that's talking to someone here at Gilda's Club, talking to your nurses, talking to your doctors, talking to friends. Again, it's important to vocalize what you're feeling. Otherwise, that emotional distress can get really overwhelming. And then once you do have some goals for yourself in place, make sure you're taking action on them. And if you're someone like me who has trouble reaching goals without having someone holding their hand to the fire, make sure you do have a buddy that you can talk to and hold you accountable and check in, whether it's daily or not. Say, hey, did you go for that walk today? Or, it's Thursday night, such and such TV show's on. Did you take a break and watch it for yourself? It's really important to make sure you have those check-ins with other people. Right. Some different concerns that people have when they're going through treatment does have a lot to do with loss of control, mortality, and things like that. With loss of control, there could be a time with your treatment, even if it's just temporary, that, more in depth than the chemo fog or chemo brain, part of your treatment could affect your ability to make decisions. So it is important early on in your diagnosis to make sure that you do sit down and talk to your loved ones about different documents where you could do something like name a durable power of attorney. I'm skipping to the second bullet point here, but that would be someone who can make healthcare decisions for you if you are unable to make them for yourself. If there were something medically driven where you could not make decisions for a period of time, that person can make them for you, and once you're back to your normal self, you would just resume control of your own actions. Living wills and advance directives, those are other forms of documents that let your doctor know exactly what kind of treatment you want. I do find, too, for the family member side, if you sit down with your loved ones and have a living will and advance directive, do it in partnership with them. This isn't just something that you need to make sure that you have. The person without cancer in the family, the caregiver, it's important for them to have this information, too. And it's honestly a lot easier to discuss when the two of you are discussing what you would want done and not done than having to think about it and bear the burden on that just by yourself. Finances is definitely something that can lead to emotional distress. You can name someone to be, you have your healthcare power of attorney, but then you can have a financial power of attorney who can make those financial decisions for you if you're unable to do them yourself. And a lot of times that could be a very different person. It could be the same person as your healthcare proxy. Just depends on your comfort level with choosing someone to make the decisions you yourself would want made. Do not resuscitate, or DNR, is another important document to have. It lets your doctors and healthcare staff know what kind of heroic measures you would or would not want taken. If you have a DNR, it's something that's great to have at home on record with you. So if by chance you had to have an ambulance come pick you up, you could have that documentation taken with you so that the ambulance service would know right away that they are not to take heroic measures on you, rather than only find out once they get you to the hospital that they shouldn't have done something that they might have done otherwise. And then finally, if you sit down and work on a will, that will designate who receives your money and belongings, and if you have children, who would be responsible for them in the absence of another parent if something were to happen to you. And I realize that these couple slides that I just spoke about are really difficult to talk about at any point of life, not just when you have a cancer diagnosis, but they are really important things to do. If you have any questions about any of this, feel free to talk to us, and it is something that we kind of encourage people to discuss. The Cancer Experience Registry, if you've been to our clubhouse, you've seen little cards about this. It's an online initiative that lets not only the patients but the caregivers kind of take action and give back. It lets you ask questions about different social and emotional aspects of the diagnosis. You can read other people's stories on there, and it gives a lot of really great resources to kind of create awareness and help you recognize some different gaps in care. So the link is on this page here, cancerexperienceregistry.org. And if you don't remember that for whatever reason, we do have those little cards here at the clubhouse. And if you haven't signed up for that already, I do encourage you to go ahead and take a look at that. So you hear people talk a lot about how you have to be your own best advocate. You have to ask your doctors questions, your nurses questions about treatment and what is normal for you. In addition to that, we encourage people to be advocates in cancer support movements, just to help ensure that everybody who's been touched with cancer has access to quality, comprehensive care that they need. And that includes both the social and emotional side of things. So by signing up or by visiting cancersupportcommunity.org, you can get up-to-date information on key issues, whether they coincide with your specific cancer or not. You can help be a network that interacts with the Capitol Hill and other policymakers to help make decisions, or that make the decisions for future treatment. And then it's just really a good way to help make sure that your voice is heard and your loved ones and future cancer patients get the support that they need. Before we move on to questions, I think there were a few slides that we still missed hearing, going back to the mouth and throat changes. Katie, if you could jump on briefly and talk about these before I open up things up for questions. I think it was just kind of the beginning portion of these slides that people might not have heard while they were muted.
I think after you came back and told me that, I think I went back and did it again.
You covered all the material? Okay. All right. So we did have a few questions that were chatted in. I'll go ahead and get those asked right now for Katie. But everybody else, you can either continue to chat in your questions, or we will be opening up the line shortly so that you can ask your questions yourself. One of the first questions we had was how to deal with fatigue. And I know that there were a couple of really good slides on there, but Katie, do you have any additional tips off the top of your head of how someone who's really struggling with that could move forward?
Well, I think, one of the main things is try to get a good night's sleep. That sounds silly. You're so tired during the day. The big problem that people do is they want to drink a lot of caffeine to help them stay up, and then they don't get good sleep at night. So if you can try to avoid that cycle. Also, it's hard when you're feeling so tired, you just want to lay down, you want to take a nap, you want to take several naps maybe during the day, but again, then you're not getting a good, solid, block of sleep at night, so that can actually make the fatigue worse. So, you don't want to do a bunch of vigorous exercise, but sometimes you do have to push yourself a little to try to stay active, get up, get out, move around some, don't just nap all day long. So and avoid caffeine. Those are the big things, I think. Be sure to talk to the doctor about it also, because, there are things that we can do. If your hemoglobin drops below a certain level, there are those booster shots that we can give, which will help to raise that up. People usually feel a lot better after starting those.
And another key concern that people had at the beginning of the webinar was nausea. And again, you had a couple great slides in there, but any top 2 or 3 tips you have about nausea?
Well, I think that, just knowing how, a lot of times you don't know how you're going to react to something until you go through with your first treatment. So we always try to prevent the nausea ahead of time, with the medication that we give before we give the chemo. But, if you know that if after your first cycle, you felt sick for 4 days afterwards, just make sure that you're keeping track of what your symptoms and side effects are, because like I said, there's so many different things that we can do. You know, sometimes we have to put people on steroids for 3 days following their treatment. Or sometimes it's just as easy as switching a nausea pill. But staying on top of things and trying to prevent it is always going to be better than waiting till you're vomiting to try to take something to make you feel less ill.
Great. And another question we had was, and Mitch, I see that you're still on the phone, so if you want to add to this question here, how do you get on a prescription for physical therapy if that's necessary?
Well, I would say just talk to, you know, just ask your doctor or nurse to make the referral, and they can do that. You know, we have an oncology rehab in where I practice that we make referrals to. There's also programs at the Y. There's Livestrong programs that, you know, you can talk to the people at the Y, get the form, have them fax them to the doctor, and they can help you with those exercise programs. But if you have a need, whether it's balance issues or, you know, weakness or fall risk assessment, any of those would qualify for, you know, physical therapy evaluation. So communication, let them know what what you think would help you, and we can help get you there.
And I actually happened to be visiting one of the hospitals when somebody was there for their very first treatment. And she was asking a lot of questions, and I was encouraging her to be her own advocate. But some of her questions were things like, well, they'll tell me right if I need to take something for nausea, or they'll tell me if I should or shouldn't be doing this. And I know a lot of times nurses and doctors do try to prepare the patient as best they can, but they can't easily think of everything. So just remind everybody on the phone that it is very important to make sure that you're asking questions and just not assume that you're being told something, because not all the pieces might be there. That's all the questions that we have chatted in right now. If people want to go ahead and press that *#, if you do have yourself muted, that will unmute you. And we'll just kind of open up the floor and see who has other questions.
Melissa just said, Katie, can you address how involved family members should be with the healthcare team? So lots of times, if you're comfortable with your, you know, if you want your family member very involved, if we have patients sign a HIPAA form saying who we can give information to, and if if you're comfortable, if they're your support system, and you want them to be able to ask anything, then I think it's great. It's great if they call and come with the patient to the treatments. You know, that's always best. That way they can answer or ask the doctor questions that they have themselves. So I think it's wonderful. I don't think that, I personally probably would, if I had a cancer diagnosis, I would always want a family member with me, because it's very overwhelming. There's so much information. It's easy to forget. And so having someone there with you to help keep track of things and write stuff down really will help you stay organized.
Hi, I had a question about neuropathy. Is there any way to minimize the extent of the neuropathy?
Well, neuropathy is a real bear, if you ask me. It depends on what kind of treatments you're getting. Certain chemo treatments, make you very sensitive to cold or hot, and so wearing gloves if you're going to be going outside, or prior to exposing yourself to not getting your hands in very cold or hot water, that can help to calm it down and help it from getting worse. But that's another thing. It's so important to make sure that you're telling You know, when you go in for your appointment before getting the chemo, make sure that you're bringing this up because each subsequent treatment can make the neuropathy worse. So sometimes we dose reduce. I had a patient just today that I only gave him one of his chemo drugs because his neuropathy had been getting so, you know, it was waking him up at night, you know. But if I didn't ask him all these specific questions, I may not have gotten that information. And so I may, you know, that's why it's important to, you know, you want your provider to ask these questions, but for whatever reason, sometimes they don't get asked in a way that maybe the patient would respond to. So make sure that you're letting people know what your symptoms are, because you may need a dose reduction of chemo, you may need the chemo held. Sometimes we even have to switch chemo treatments. There's also several medications we can try to help alleviate the pain from neuropathy if it is painful. Does that answer your question, kind of, or?
Yeah, I think so. I just didn't know if there's anything you could do proactively that maybe would make it not be as worse as it otherwise would be if you're going to have that side effect.
Fortunately, it seems like it's we never really know who's going to get it. We know certain treatments are more likely to cause it than others, but some people really don't have a problem with it, and other people have a horrible time with it. There had been studies before that had on whether giving certain, you know, magnesium infusions with the chemo, would that decrease, you know, the incidence of neuropathy, and we haven't really found anything that makes a big difference in preventing. So it's just kind of monitoring, and if it does start to occur, watching it closely and either dose reducing or changing treatments.
Okay, thank you.
Anybody else have a question?
Okay, I think we can go ahead and assume that there's no final questions. Before I pass things back over to Kelly, I just want to thank everybody for attending today. If there were any questions that you had regarding any of the slides that I'm just seeing someone type right now, so I'm slowing down in case there's another questions. But if you do think of any questions after the fact, please go ahead and either email us and we can cover them, or you can definitely bring them to your group. Katie, I did have another question come in. Oh, this is a great question. How do you get your mate to tell the doctor everything?
Well, that's why it's it's nice if the patient, you know, because I always tell people you're the boss, you know. So if they want their family member with them, or their spouse or their partner or whoever, you know, and if they're in the room, you can bring up those concerns too. And sometimes, I mean, you know, then the provider would have to ask if it's okay to talk about such things. But I mean, it's hard for Kelly, do you want to help me out on this one? It's hard to talk about difficult things, I guess, and it's hard to really address those concerns. But if you bring it up and open the doors of communication, go from there, I think that's helpful.
Yeah, and I know I think that part of the concern is maybe if the family member is not with the person going through treatment, if there's anything else that can be done to encourage the patient to ask the doctor everything. And just to shadow what Katie was already saying, it's really just making sure that at home you're having the conversations that you need to be open in your communication, and going back to being your own advocate. If the doctors don't know everything that's going on, then they don't have all the pieces in place to give you the right suggestions with your treatment. If you're having a side effect to one of the treatments, if they're not aware of that, they have no way of knowing if there's a different treatment that would be better for you, if there's other medications or other activities that they could suggest for you to kind of counter those side effects. So without being completely open with your doctors, you're really cheating yourself. And maybe with some people that's the way to put it across to them, that they're not going to get the best care possible if they're not sharing everything with their doctors. I don't know what your thoughts on that are, Katie.
I agree with that, just because, well, like we were talking about neuropathy earlier, that is just it just makes me crazy because it can be so uncomfortable for people. But a lot of times people think, oh, it's not that big a deal. I don't need to talk about it. It's fine. It's fine that I'm having, diarrhea. I expect that. I'm going through chemo, but then you're getting dehydrated and, all these other problems that we could help make it, help to make you feel not so miserable. You don't have to feel this treatment it's not a walk in the park by any stretch of the imagination, but, we can do things about all these side effects. There are things that we can do to make you feel better while you're going through it. And we're here to help, and we're here to listen. And so just, just don't hesitate to bring up concerns. And if you signed the HIPAA form, like for a family member, if you have concerns about your loved one, we have family members that call and, bring up concerns and issues that they have, and, would say, like, is there a way that you could bring this up, in a more subtle manner if it's like a sensitive subject? I've experienced that before. So.
And I guess another suggestion I might have is, have your spouse watch this presentation, and that might get them thinking of questions that they have on their own that they could be asking their doctors, especially this last couple minutes here where we're answering this question directly about why it is so important to being transparent with your doctor so they know what's going on with you. Kelly, I think we'll pass things back over to you.
Right. Thank you so much. Again, I'll remind you that if you have any more questions, you are welcome to email Kelly at gildasclub2c.org. Sorry about that. And Kelly, do you want to just type your email address in the chat box maybe while we're wrapping up, and that way people have that, as well as maybe your phone number? That might be great. Thank you all so much for joining us today. We will, as we've mentioned, have a recording of this webinar available online. If you look down in your web links window, there is a link that says today's webinar recording will be posted here. If you click on that and then click Browse To, that will take you to the page you can bookmark and come back to later if you'd like a recording. Otherwise, Kelly has offered her email address and phone number as well if you have questions or are looking for a recording at a later time. We would also ask that you take just a moment to give us some feedback on today's webinar. Also in the web links window, there's a webinar evaluation. I'm going to pull it up on some of your computers. It may not open on others, but you can browse to it yourself if it did not just open on your computer. If you would take a moment to fill out this evaluation, I know it would be really, really appreciated. Tell us what you thought of the webinar. And those who are just joining us on the phone should have already received a hard copy of the evaluation in your packet, so that can be filled out and returned to Gilda's Club at your convenience. So thank you all again, and I hope you enjoy the rest of your evening.